Chicago's Power Hour. I'm your host, Angie Mills.
You got a while. Well, you got a couple minutes.
AKA Terrence Daniels. I wish I had one witness in there. You got one. You got a couple of them. You got two teams. Give me a testimony. Oh, Lord. He's did it before. Oh, Lord. I got I got 5 reasons. 5 reasons. Oh, Lord. Turn it around. Turn it around. He woke me up this morning. Don't do this. Don't do this. Go ahead. He woke me up this morning. Come on, number 3. He woke me up. He woke you up. That thing can touch you. One of them 5s will get you. What's the second one? He woke me up. Yes, sir. Yes, sir. Oh, my God. And number 1 reason. Number 1. Final answer. He woke me up this morning. He woke me up this morning. That's a testimony. That's a testimony.
Yeah. Ron, I'm trying to get show started, bro. I'll call you when I get through. Good. Okay, cool.
Good morning. Good morning.
Go back out. Audio is coming through the up, not coming through the switcher.
Bring those lips to me. I miss it already, girl. I'm missing all those. Missing all those kisses. Baby, bring those lips to me. Oh, baby, I'm missing all those kisses. Baby, bring those lips to me. Good morning, good Sunday morning, folks. This is Tasha here on What's in It for the Black People Media with I Do, I Did, I Don't, the show that is about helping you to survive and thrive and to holistically be well as you contemplate or go through a divorce or as you are now on the other side of it. It is about helping you to be better on the other side. So I am glad to be here this morning and glad that you are joining me. And I am super excited about our guest today. My guest today is Dr. Sonya Dinizulu. And Dr. Denny Zulu is a pediatric psychotherapist. So she is doing amazing work with young folks. She is a PhD, and she is joining us to talk about children coping with divorce, coping with trauma, as we seek to figure out how do we walk through this process and how do we make sure we're well, but also make sure that our children are well. So she is an assistant professor of psychiatry and behavioral neuroscience at the University of Chicago. Dr. Dinizulu is a practicing therapist and a supervising therapist and researcher with expertise in family psychotherapy, adolescent chronic stress, violence prevention, mental health, and disruptive behaviors. And aside from that, basically, she's a badass, as I just read, right? She's doing some great work, and she is leading some trauma research in Chicago. So one of the leading researchers and contributors to trauma with children. And so we're going to bring her in and talk a lot about children. And so as you are joining, I want you to like the broadcast. I want you to share. Definitely. We all know someone who could use this information. So please like and follow and share What's in It for the Black People Media, as well as the I Do, I Did, I Don't Facebook page. As you have questions, type them in the chat. We're going to talk through some things, and we may have an opportunity to bring up some of those questions and comments that you may have related to these subjects. So as we're getting started, one of the first things that I started thinking about as it relates to children is when we talk about divorce, oftentimes there's this whole discussion about whether or not the kids are going to be well in the process. And many times the assumption is they're not, that divorce is a bad thing for them, that it is traumatic, that it has all these negative outcomes associated with it. We have talked about that a few times on this show. And so now we have one of the experts that's here to talk to us about it. And so I'm going to start there, Dr. Dinizulu. It's great to have you here, first of all. Thank you so much for joining the show this morning.
Well, thank you for having me. It's early, but I'm so happy to be supportive. So you want me to start answering that question?
Yes, would you? So
yeah, okay. I know there's a delay. Okay, so yep, so the children will be affected by divorce. We're talking about two households now being created, coming from one, and you have to talk about what is it like for kids to transition from being together as one pod now going into two different pods. So you have to expect some type of reactions to that. No different from if they had a new teacher from at school. And no different if they had to, go away for the summer and spend 3 months with a relative. Okay. Now, there's going to be transitions from coming from the norm and going to something different. Go ahead.
I was just going to say, so as you're talking about this, it sounds like the big change for them is the fact that it is a change and it's a transition to a different life than they've experienced before.
Correct. Yes.
Okay.
And those changes can be facilitated in a way that can make it a little bit more smooth, or it could be a little bit more tumultuous depending on how the parents handle the situation.
Okay. So is it, in general, is it just going to be tumultuous because there's change associated with it, or can it really be smooth? Because we seem to always think that this is going to be a very difficult process for the children. But I hear you saying it can be a smooth transition.
It can be. It really depends on the child. It depends on how the situation is handled. Some kids have different, what we call internal resources. So things that they have within themselves. Some of the kids have stronger coping strategies than other kids. Mm-hmm. Some kids have been able to feel relieved that their parents are getting separated. And so some kids have asked for their parents to get divorced or get separated because it was just too much negativity within the home. So it really does depend on the child, and the parents really need to know their kids. Even with those who may be able to handle the situation a little bit better, there's still going to be some sense of loss and grief And it's not related, grief is not always related to death. It's also related to losing something that you once had.
Okay. So as a parent, then you're walking through your own grief process as you're dealing with the impact of a divorce or separation, or, as you're deciding what you're going to do, you're walking through that and dealing with your own grief. And then layered on top of that is the children having to know what they need and supply what they need in order for them to be well at the same time. I think that's a tall order for parents, especially when it is it was unexpected or it's very contentious. It can be a very difficult thing for parents to walk through and have to make sure that the children are being well. So I heard you say this is really about, you got to know your kid, you got to know your situation and understand how that relates. So can you tell us just a little bit about how a parent might assess what's happening with their child, and if they know that their child can be what do they need to look for?
Yeah, it's a really good question. So one of the things, you want to ask, talk to your children about is just, the reasons why the divorce is happening. And it's not the reasons that you may share with your girlfriend or guy friend or another friend or family member. It's a reason that's going to be developmentally appropriate for your child, even if they are teenagers. Sometimes parents can be so hurt about the reasons why a divorce happens, and they feel like their kids should know that, well, really it's the other parent to blame. And again, save those conversations for the other people who can handle that information.
Okay.
The kids, so that's one thing, to make sure that they have an understanding. And then, to, talk about how we can try to establish a new normal, and that the common goals that are going to be shared between both parents so that the kids can feel safe. So that's a couple of strategies.
So if your child is one of the children that really just has a hard time with transitions, what kinds of things could you, just in general, even when they're good transitions, it's just not what they've expected. Their mind is sort of set to, this is what we've planned, this is what I'm expecting to happen. And so if that is your child, then how do you help them to get through the process?
Yeah, for those kids who may have difficulty with transition, I think it's going to be the same pretty much strategies that you have to repeat over and over again.
Mm-hmm.
So it could be the same words of, this is we know this is something new, and validate how they're feeling. We know this is really tough, and you may be angry or sad. So validate what they're experiencing, rather than saying, well, you shouldn't feel this way. It's been a couple of months. Why haven't you adjusted?
Mm-hmm.
So you definitely want to just be at their level. It's going to take time for them to transition, and then come up with the structure of like rituals and routines to help them know that this is predictable. Sometimes with transitions, kids worry about like what's going to happen, and I don't know what's going to happen next.
Yeah.
So having, like, when you go to mom's house or dad's house, or even for same-sex couples, like when you go to either parent's house, you want to make sure that, hopefully in both households, they can be the same routines that could happen. So for example, still have a bedtime routine, like both parents keep up with reading books to the kids if that was something that was done before. Eating meals together, for example, if that was something that was done before. So hopefully the more alignment between the two households can help with the transition as much as possible. But it's going to be tough. You're going to have compassion and be really patient, and just roll with some of the resistance our kids may give back. They have every right to, right? Yeah. So we have to validate, like, this is not their fault.
Yes, and I imagine it's like their entire world is kind of shaking, and things are different for them, especially if they didn't see it coming or expect it, or they're not the children who were thinking, oh, these two people don't need to be together because of either violence in the home, or they're just seeing arguing and contention all of the time. It just doesn't feel like a comfortable, safe haven for them. In the sanctuary that a home should be. So when they're feeling that, like you said, there could be this sense of relief on one hand that the parents are divorcing, or separating. But on the other side of that, you've got kids who are like, wait, what just happened? Like, everything that I knew to be true and everything that I knew to be foundational for me is no longer the case. And that can be extremely hard to work with. It's like, having the ground shake underneath you in an earthquake. We're always very sure that we have a place to step and it's going to be secure for us. And now it's not anymore. It can just kind of open up and you never expect that to happen. So I can imagine from the kid's standpoint, it's a very, very difficult thing. I think I always struggle, and my struggle was dealing with my issues and having to be there and be the parent to sometimes put that aside and help the children. And having 3 children with 3 different ways of handling the situation was sometimes just felt kind of overwhelming. And I know that they needed their support and individually, but then I also needed that too. And so it's a challenging thing, but I think in general, as parents, we want our children to be well. And so we're willing to do what we need to do and sacrifice sometimes and make sure that we're well so that we can take care of them. And so you talked about this having kind of helping the children to transition to something new, this new life where they're in 2 different homes and they're, back and forth, or maybe they're not as, maybe often it may not be. Mm-hmm. But sometimes the breakup is and the separation is very contentious, and that may not be the case. In those situations, how would you advise parents to handle that with their children when they may not have that same continuity?
Yeah, all we can do is just try to get our parents to possibly get their own therapy to help them be better co-parents, to co-parent better with the other person or with the other parent. The truth is that, there's many families that I've worked with when the parents were continually to be contentious for a number of years, it affected the kids. So, I am the kids' therapist, but not the parents' therapist. So I always recommend for them, if they can, to get their own therapy or seek some type of counseling through spiritual religious means or through other friends, read books, because not everybody can see a therapist.
Right.
I want to recognize that because of insurance reasons or for whatever reasons. But the parents really do have to sit down and check within themselves, like, how much of this is really hurting my kids? Is it really worth having a conflict with the other parent? When we have kids, you take there is no oath, but I guess there's an oath, depending on what your religion or spirituality is that you make, that when you have kids, you're fully responsible for their care and their well-being. And, it's no different from taking them to the dentist or their pediatrician for well-being checkups. Those don't happen very often, but within the home, it's our responsibility to make sure that they are, cared for, not just with their basic needs, but their emotional sense of safety and needs. And if parents cannot do that for each other, meaning the other parent, by getting along, then the kids will experience that. Some kids can come through that conflict, the parental conflict, somewhat okay, but a lot of kids do continue to struggle. And sometimes that carries over into adulthood.
So what does that struggle look like for the kids?
Yeah, it's a good question. So the struggle could look like in the form of like either behavior problems, so kids can talk back to their parents or other adults. They can have, and this is going to look, behavior problems is going to look different for different age groups. So for younger kids, it might be having more tantrums. For school age kids, like meaning from like 1st grade up until like 8th grade or so, or 5th or 6th grade, it could look like behavior problems too, but also just the type of behavior problem wouldn't necessarily look like a tantrum like a 2 or 3 or 4-year-old, but more of a tantrum for those kids in that age group could be, again, just talking back, possibly getting into arguments with other people, mimicking what they see with their parents. With their teenagers, same thing. With the caveat is that they can move about their world more autonomously because that's what we want our teenagers to do. So they could run away from home or stay with another friend's, stay with another friend's family. They could also argue and talk back and get into fights, have chronic irritability with other people.
Yeah.
So those are the disruptive, like the behaviors. But then we have the internalizing, meaning the kids who may not necessarily act out, but they just take stuff in. So they can be more withdrawn. more irritable as well, but not saying anything or doing much and not wanting to be around family members. So there's two different opposite ends.
Okay. Okay. And so some of that sounds pretty normal for the kids. So how do you know when it's abnormal, I guess, or when it requires additional attention because of the situation of a divorce?
Yeah, so there's a couple of ways I want to talk about this. One, let's put it in the context of if the parents are co-parenting pretty well. The first year is going to be the hardest year because, again, it's going to take a while for kids to undo, depending on how long they've been living with the family, it's going to take a while to, like if they've been living together as a family for 10 years or even 5 years, a lot of their growth and development happens, a lot of the important things happen within the first 5 years of life. So you have to expect it's going to take, quite a bit of time for the transition.
Yeah.
But during the transition, if the parents are co-parenting well, keep the kids out of the middle of the conflict, if there is any conflict, and they're providing, routines, structures, occasionally they can do things together as a family. So let's say things are going well and the behaviors, again, like you said, are normal, they're acting out, or withdrawn, or not doing well academically. But, if things don't get better within, I would say about a year, and that's a long time. So you want to monitor over time. Then, you might want to see someone. The other thing I want to mention too is that, sometimes academics can go down and some parents are like, I can't wait a year for the grades to go back up. So, again, you want to pay attention to the grades. You want to check in with your child to see what their needs are. And it's okay for them to be in therapy. Even this is normal stress. Like people think you have to go to therapy for a crisis. So I would recommend if you're able to get some counseling around this to start a little earlier, before the year is up. Now for those families, where the conflict is really evident, and the kids are seeing it and they're put in the middle, that you'll probably start seeing problems more intensely right away. And then the problems can be enduring for as long as the parents maintain that family system to be conflictual. It will have an impact on the kids. And I've worked with kids I have one case now for 5 years because the parents continue to have conflict. And when we talk about family systems, when one person's affected or two people are affected, the whole family system is affected. So in a sense, we're saying that parents, caregivers who are not able to manage the conflict are keeping the whole family in conflict.
Interesting.
So it becomes really challenging. Yeah.
All right. For those joining, you are listening to I Do, I Did, I Don't on What's in It for the Black People Media. We are talking with Dr. Sonya Dinizulu about children and coping through divorce and strategies for parents to help your child to thrive through a separation or a divorce. And we were just having a conversation about the fact that some of the damage can be long-term and enduring to children if they are experiencing continued conflict in the separation or the divorce between the two parents. And I'm wondering what that enduring damage, I guess is the way I would say it, but what does that look like then for the child?
Yeah, so some of the kids that I've worked with currently and in the past, when the conflict is enduring, and then talking about just now, I haven't talked about young adulthood yet, emerging adulthood, but risk-taking behaviors for our teens, if the conflict started in childhood, now it's spilling over still into adolescence. It could be teens experiment with drug use anyways, but it could be more chronic drug use. It could be just, again, running away from home, unprotected sex for teens. It could be, again, fighting, getting into arguments with people. And then the poor academic performance, we typically see that. Not for every teen. Again, some teens, have ways to protect themselves from the divorce or separation. And so some kids find that, doing well in school gives them a sense of purpose and meaning within the school community. If they can't find one within their family community, they get it from the school. So I don't want to say everything is going to be bad. I'm just listing a whole bunch of different things, but you really do have to know your kid. Every kid is resilient. That's why I love working with kids. They're so incredibly resilient, and every kid has some level of strength. And I think what parents can do is find out what are your kids' strengths and really capitalize on how to help them, master those skills or do well with those things. And it's in a system that seems really topsy-turvy to them. So, giving them a sense of control and sense of direction could come through, schools, academics, other family members, extracurricular activities. There's so many things that kids are involved in. Hopefully you can find and pick something that they feel like that they can, gain a sense of control and feel like they can do really well in something.
So that sense of self-actualization and control for them, or something that they're doing well and excelling at, that alone is something that's a very good coping strategy, it sounds like, for the children.
Yeah, protective and a really good coping strategy. Yep.
Yes, interesting. Okay, well, I think we're going to take a break here. We are talking to Dr. Sonya Dinizulu, and we're talking about helping children to survive and thrive through divorce. She is a pediatric psychotherapist, and we are getting some really good tips, both for parents and for children. And so we'll continue the discussion on the other side of the break. Stay with us. Make sure you like and share the broadcast.
WIIFTBPN.
Welcome to Inhale, Exhale, you guys. We are your health home girls, Dr. Tanksley and Danny Time. We are being joined today by a guest, Samantha Allen, who's going to work with us today about attachment styles.
The overview of attachment styles is basically how we connect with people, how we have relationships. And I just want to clear up, it's not just about romantic relationships with your family, with your friends, how you host relationships, period. It's important to look at yourself and figure out, what am I contributing to the relationship, or why am I attracting this style of a relationship? So all the attachment styles develop from your caregiving style. They say that from 0 to 5, you have already developed your attachment style. If you had a secure attachment style, your parents were very in tune with your moods, in tune with your behavior. They kind of soothe you when you cry. For secure, you grow up to be more communicative. You have good communication style. You feel positive about yourself and about others. You just have you're able to set healthy boundaries, so on and so forth. And that just comes from the love, attention, and caregiving that you were given as a child, which usually develops a secure attachment style.
So on that note, with healing these things and changing your attachment style, we're reprogramming ourselves. Right. It's like our inner child that is showing up in these anxious, attachments, and we are wanting our way. We're reprogramming.
Oh, you proved me wrong. This ain't a regular love, babe. It's that waking out your sleep with me massaging your feet. Yeah. It's that anything you want, I'm only here to please you. Until I met you, and I don't know if it's real or is it just a phase I'll go through, but I feel that it's true. We don't need no labels, babe. What we got is something different. We don't need no labels, babe. Lady, we don't need no labels. That what we have is something special. For sure, for sure. I don't feel it's a one night stand. No. It's that look you in your eyes. Make love in paradise. Our one life stand. It's that sweep you off your feet. Give you everything you need. That's what I'm feeling. It's that pick up the phone, cause we wanna be alone. And I never thought I'd feel this way, then you came along and proved me wrong.
right. Welcome back to I Do, I Did, I Don't on What's in It for the Black People Media. Again, please like and follow and share the broadcast, both on What's in It for the Black People Media page as well as the I Do, I Did, I Don't page. We are talking today about helping children to survive and thrive through a divorce. And we are speaking with Dr. Sonya Dinizulu, who is a leading doctor and a leading therapist in this area. She's actually an assistant professor at the University of Chicago in pediatric psychology. And, you know, Dr. Dinizulu, I would love it if you would give the audience a little bit more information about yourself and who you are, and then we'll kind of go back into this conversation about things. But you've been researching for a while, so tell the audience a little bit more about you.
Sure. So I don't know how far back I should go. I'm from New York originally, not from Chicago. But my work in terms of what I do, again, I work with children, adolescents, and families, and young adults as well, who are just in need of, therapy to help maintain mental health wellness or to address any kind of illnesses that they may be experiencing. And I worked with families, again, who have experienced divorce or separation. My specialization is working with youth and families exposed to chronic trauma or violence. And so I do a lot of work in the city of Chicago, mainly through the University of Chicago and partnering with other institutions. But we are very, very vigilant about addressing community violence within our communities. And again, community violence is happening right outside of the University of Chicago doors. It's like, a stone's throw away, unfortunately. And I'm part of the team that is trying to build resources so that our communities can access mental health services through the institution to help address the effects of community violence. And we're also taking a public health approach, meaning that we're just not, again, taking in families or individuals who might have been shot or stabbed or wounded. So we're a level 1 trauma center, meaning that they can come to University of Chicago finally for level 1 adult trauma care versus going to the opposite ends of the city. So we're not just patching up people and sending them out the door. We're actually trying to provide case management and sort of case manager services for those people who survive. And a lot of people who are shot are not actually, they don't pass away, they don't die, they actually survive. And the ramifications that stem from that need to be attended to. So at the University of Chicago, we have a team of people, a group of people who are working with trauma across the lifespan. So for example, if a father came in, 27-year-old who might have been shot and has 2 kids or supporting family member or significant other, we can literally see the whole family for therapy in terms of the mental health piece. That's something, again, we have to treat the whole family when it comes to when one person gets hurt, the whole family system is affected. And the whole community too, honestly, is affected when things like this happen.
That is amazing work. And we don't hear about that as often, that work is taking place at the University of Chicago. And so for anyone that is watching, if you find yourself in a situation that has been a very traumatic situation and your family is in need of care, do reach out to Dr. Dinizulu, reach out to the University of Chicago for support. I'm sure there is far more need than there is support available, but I would say reach out. Yeah. It sounds like they work with other institutions as well and may be able to match you with other places that can provide support for you. So amazing work and absolutely needed in the city of Chicago for sure, and definitely on the South Side. So I'm really glad that University of Chicago is now that level 1 trauma center, and then providing that that support holistically for families and for the community. And so you talked about trauma. Is divorce? Are children experiencing trauma from divorce? So we can level set that.
Yes. So I'm going to say it depends. Trauma, I don't use the word very loosely. When people say, well, that was traumatic, because if people saw the work that I do in terms of trauma, then you would say, okay, I'm glad that this is not trauma.
Yes.
So when kids go through a divorce, and the families go through a divorce, I think the trauma is more apparent if there's violence within the relationship. So
Okay.
there's been families that I've worked with, again, they're referred to me because of domestic violence. Again, when we talk about trauma and violence, you know, the most common form of trauma is what we call interpersonal forms of violence. So it could be child abuse, again, person-to-person harm,
Yeah.
domestic violence, community violence even is still person-to-person harm and is often random. And then we have trauma like car accidents, dog bites, natural disasters, which are not interpersonal forms of violence. So, and there's specific treatments and goals and therapies that we provide to help address those traumas. And it's often around like worrying about someone being harmed, or yourself being harmed, feeling like you have a loss of sense of control, you have extreme fear. So those, you know, for kids going through a separation divorce, that may not necessarily be the case, except when, again, the divorce is surrounded around like domestic violence or a lot of family violence happening.
Okay.
And then in itself, you know, it's not even about the divorce. It's really about the violence that's happening within the family that we address.
Okay.
So, so the divorce, you know, can only play, maybe the actual divorce may play a little bit of a role of the kid experiencing stressors of, let's say the parent was a good father. I'm going to use male and female because oftentimes when we talk about domestic violence, it's the male, you know, perpetrating against the female. The father could be a good father to the kid and never had done anything to the kid, but may have done something to the mother.
Mm-hmm.
And so you know, again, the separation could cause stress for the kid about, oh, I might not see my dad. Is that traumatic? Probably not, but will it add more stress to the kid seeing the domestic violence for so many years and exacerbating the symptoms related to the domestic violence? Sure. So it's really interrelated, but typically, generally speaking, we don't think of trauma or we don't think of separation or divorce as traumatic for kids. It's a stressor, and it does have mental health. It does have effects on the mental health for sure.
Yes. Well, that is actually really, it's a good thing to hear that it's not necessarily thought of medically as trauma. And the reason that's good is because then there are likely better outcomes and maybe not as heavily weighted not weighted, but maybe not as heavily required intervention. Still intervention required. I'm really glad to hear we talk about therapy on this show a lot. I talk about it. I think it is absolutely necessary. To me, it's like preventative maintenance. It's something that you do. It's like getting an oil change on the car just to make sure that it's still running and things are well. I think it's a really, really important thing if you have access to it. And if not, then you find ways to make sure that you're well. But I'm glad to hear that it's not necessarily traumatic when you look at the definition of trauma being person-to-person harm or being those things that are like natural disasters, a house fire, an earthquake, a tornado, you know, kids experiencing things like that. So it's a stressor, but it can be traumatic depending on the situation that the kids were in. And we talked about this at one point on the show. We talked about the fact that so many times there are all these negative consequences laid out on about how children fare. And there is new research that says that maybe some of those negative outcomes were related to the marriage as opposed to the divorce, that many of those things could have been the result of the life that the children was the child or the children were experiencing beforehand. And so, you know, there's this body of research now that is acknowledging that more, and not just saying that divorce is the reason for all of the negative outcomes with children, but many times it's a better situation for the children to get divorced when they have been experiencing something that would be considered traumatic. You're seeing abuse, you're seeing whether it's mental or physical or sexual abuse, things like that now are going to put the child in a better situation. So they're not necessarily worse off because of the divorce.
Correct.
Sometimes they were worse off in the marriage, and it's more important to have them in an environment that's going to be well for them. So I'm glad to hear you say that. And I think it helps us to really think about this is a stressor. It can be a major stressor. It's not necessarily a traumatic situation for the child, but it can be. And those are extreme cases when it can be. And so what that means is we're more empowered. As parents, we're more empowered to do something to really help our children to make it through the divorce, the separation. As you... Yeah. Did you want to add something to that?
No, I was going to say, you're right on point.
Awesome. So, as we think about this and think more about what do we do as parents, we've talked about some of the things that the children could experience at different stages. It could be tantrums. It could be that they're getting into fights. It could be the talking back and, throwing maybe larger size tantrums for kids that are a little older, so it doesn't look like falling on the floor and flailing around like it might for a 2-year-old. And then as they move into the teen years, it could be risk-taking behaviors, like maybe they're experimenting with drugs or using drugs or having unprotected sex, things like that. As a parent, then, when you are parenting children through that, we've talked a little bit about some of the strategies that we can use, especially for the younger children. What about those teenagers? Those can be really tough situations for parents to walk through and manage if we're talking about things that could be risky, like divorce. No, like like drug use or sexual activity. And so what kinds what advice, what kinds of strategies should parents use to help their children in those situations?
Yeah, this is tough. Again, the first strategy, again, is for the parents to co-parent well and to have consistency across households. Not every household is expected to be exactly the same. It can't be cookie cutter because parents are different. They have different parenting styles. They could have different parenting styles. But the goal is, number one, is to make sure that you have a lot of consistency across households. And again, if there's conflict between the parents, I would still stress that as much as possible. Start with something small and then work your way up to something big. Like, for example, a father could let, his male teen go about in the community and have a curfew that's much later than what a mother would allow for. So come up with a negotiation of like, what's the common curfew that both households can agree to, and of course discuss with the teen. So that would be just an example of like, how do we keep consistency across the households? The other thing is how to, with your teens, this is just true no matter what house, if they're in the same household or not, but you should be monitoring your teens. So parental monitoring is huge. Like, know who they're talking to, who they're hanging out with, invite their friends over. I know we're in COVID, so we have to think creatively about that. But I would encourage, for your kids or your teens' friends to come over so you can get to know them as well. Because you want to keep up with who their friend groups are, who their social pressure, where there's if any peer pressures are coming from. So that way you can have these open and honest conversations like, okay, I see that you may be engaging with some friends who are, are they good influencers or bad influencers, because it's really easy for kids to, teenagers, peer influence is much greater than parental influence in many different things, except for politics, they've learned, right? So you want to make sure, like, as a parent, I don't think even in a two-parent household, 2 parents are not enough. You really do need a whole community. But it's really important to look at, extend your interest and your monitoring beyond just what's happening within the home. Like, you really have to know what your teenagers are doing, get to know their parents, and let the other parents know that, hey, we're going through this tough time. If you can help console or help counsel my kid, of course, if you trust those parents through this, I don't think the 2 parents have to do this by themselves. So Absolutely. Especially for teenagers, I think it's really important to know who's in that village.
Yes, absolutely. Sometimes they have to hear it from somebody that's not their parent in order for them to really listen and hear it. So you talked about consistency within both households, and one of the things that can help to drive that consistency is called a parenting plan. And a parenting
Mm-hmm.
plan sometimes is developed in the course of the divorce that says this is how we are going to engage with each other and behave. This is beyond here's who gets Christmas and Thanksgiving on this year. It's not the allocation of how you spend the time with the children, but these are the norms and the behaviors that we are going to agree to in order for this to function well within a co-parenting situation. Now, many times people will separate and divorce and they don't have a cooperative co-parent. And so they're not in a co-parenting situation. But in this situation where you have the children moving back and forth and both parents have a decent amount of time with the children, it's important to have that parenting plan, which oftentimes can be developed, like I said, during the course of the divorce or afterwards. It's something you can work with a mediator, something you can do on your own if the two of you can sit down and have a conversation about what's really important, what are the behaviors you see, and what are you trying to help your child walk through in order to continue to be well. So something to keep in mind is, do you have a parenting plan that can help lay out the kinds of things that will drive consistency for the children? And if not, something to consider actually doing. Do you actually do any work where you might help parents to develop that it's not your body of work necessarily, but have you ever helped them to develop a parenting plan?
Oh, absolutely. We do plans all the time, even outside of the context of divorce or separation. So it's the same phenomenon, same rules that apply in terms of, like, we call it family problem solving or collaborative problem solving. With the work that I do, when we come up with plans for families, whether they're separated, divorced, or going through that process or not, we always get the youth voice and get them involved in helping to create this plan. So yeah, this is something I do. It's just that the strategies don't change. It's just the context may give a different reason and may give more conversation around the plan in a different way, but the strategies are exactly the same for the most part.
Okay. So I always like to give people some solutions. Like, we talk about some of the problems and solutions, and we've sort of been talking through that. But what kinds of things then should they build into a parenting plan if they're thinking about that and trying to make sure their child is well? We've talked about consistency a lot, and things like probably activities that the children are going to take part in, and making sure that they can do those activities when they're with either parent. It's bedtime. We talked about that. It might be curfew. What other kinds of things should they consider building in and having those conversations with the other parent about driving consistency so that the kids feel some kind of level, stable ground?
Yeah, so I think talking about a sense of safety, so emotional sense of safety. Mm-hmm. So when things go wrong, our family should ... So I think of, how to cope with a stressor that could pop up in the family because, we're not together for Christmas and we always had Christmas together. And now we're not doing it together because, one of the parents is off doing something else and the other parent is not here. Right. So, I'm just making this up. Or it could be, to help us reduce stress or conflict. Maybe, again, if the relationships are healthy between the two parents, maybe as a family, we do spend some time together on these particular holidays, So again, the emotional sense of safety is helping kids feel like they don't always have to be in distress because they don't have what they used to have. And so I think talking about, this is just an example, again, talking about coping strategies on how to deal with something when something goes wrong. So, or something doesn't feel good to the family. So it could be that we saw our parents argue over something and it made me feel upset. So how do we handle that? Like, our parents are not able to exchange words, or they're really, really, shutting down and not talking to one another. And it doesn't make me feel good as a kid or as a teen. How do we handle that? Right. So it could be, whoever the teen is staying with, they can talk to that parent and then hopefully that parent can then share that information with the other parent. or that's, again, this is putting somebody in the middle if this approach was taken in terms of the teen talking to both parents, because then that's too much, right?
Yeah.
But it happens. So I'm only mentioning it because it happens. Even if I say, please don't do that, it still happens. So I'm just throwing it out there because that is still a strategy, but it may not be the best strategy. But the big picture is talking about emotional sense of safety, coming up with a safety plan around that when things become really stressful or distressing. How do we handle that level of stress within the family? It could be going for a walk. It could be like breathing together. It could be just problem solving together. So again, we always talk about routines of like bedtime is at this time. We always talk about, who has who on what holidays, but I don't really see in plans like when stuff goes wrong, how do we handle it together as a family? How can we write that down?
Okay.
So that would be my recommendation. And that's what I do normally, again, outside of kids who are divorced or separated. We talk about that in the family plans, but I often don't hear like courts talking about that. Or when I do get, parents, they're talking about their family agreements in court. It's never talked about in that way either.
Yes. So parenting plans absolutely should have a few elements. Number one, how do you maintain consistency across household and things like activities, bedtimes, even some of the expectations, I would say, around household duties and things like that. And homework time, probably. That's, not probably. Homework time is important. What should we, when things go wrong as a family, we do ... Very important piece that you understand how to engage with each other and how you're going to solve your problems together, or how do you just calm down? I am totally taking this lesson for today because yes, I could use this myself. So I'm learning a whole bunch at the same time here. So when things go wrong as a family, this is how we handle it, what we do. Definitely not something that's discussed in a parenting allocation plan as a part of the divorce and that gets entered with the divorce decree. It is not in there. So what are the other norms about how we engage with each other and the children? And so I could see how this gets really, really sticky really quickly, right? Because you've got a child that feels more comfortable talking to one parent versus the other. And so they may mention how they're feeling or what they're experiencing to one parent, and the other parent is not so happy about that because they didn't work through it with them. That feels like that's one of those things that belongs in this agreement on how are we going to do this and how do we engage the children to make sure that they're being heard, they have a sense of emotional safety, but also we're guiding them into how to work through the problems with the other parent as well.
Right. I think I would say, when I say quicker ways, it doesn't mean like it'll happen by next week. It's relative. But I think one of the ways to help maybe expedite the process is if the kid can see how the parents model in front of one another how to resolve a conflict or how to talk to one another. Mm-hmm. And when the kid sees that, like, oh, if my parents can talk to each other like that, then maybe I can talk to the parent that I'm not talking to as well. The other thing too is that parents have to set aside their egos. Yes, we're all have some level of narcissism because we have kids and we're so excited when they look like us, right? So that's a level of narcissism and our egos. And so we expect like everything else to fall in line with my kid needs to talk to me. They need to do X, Y, and Z. Why don't, so keep the ego aside. Again, it's so not about you as a parent. It's really about your kid. And if your kid is not ready to talk to you, then earn their trust. It's up to you. Don't expect them to just come to you. You have to find a way to earn the trust. There's so many different ways you can do it. And you're just going to have to be patient. And also keep in mind that it's helpful that the kid is talking to somebody. And if it is the other parent at the moment, it doesn't mean that you're the worst parent or the lesser parent. It just means that your kid is just finding a sense of safety and security in one parent at that time. And it's not a competition. Like it can happen and it will happen. Again, a lot of factors I think have to be put in place. It's a multitude of factors, and I can't partial out and say which one is more important than the other. I don't have that body of research in my mind in the moment, but I do know some of the common things to keep in mind is that modeling for your kids how to resolve a conflict with the other parent. And conflict is not always bad. Conflict is good, helps build character. It's just a matter of how you deal with the conflict. That's when it's either bad or good, how it's managed. And then just earning that trust, spending more special time with that kid, coming up with, open-ended questions. So much of like, did you have a good day today versus how was your day? Or tell me the best part of your day. What was the best part of your day? And let them, fill in the blanks for you. But it's going to take time and patience. And, again, egos can be bruised when separation and divorces happen. And then you wonder if the kids are going to like the other parent. That's all normal to feel, but please don't let that get in the way of you being an effective parent. And remember, it's so not about you. Your kids did not ask to be here. They were brought into this world. And so, I'm a staunch advocate for kids, that, it's not their fault. And it's really our job to hold the emotional burden for our kids and stand by their side and be patient.
Wow, you said a mouthful there, and I'm just thinking culturally how challenging that can be for us sometimes, because we are definitely the parents that are about respect and you do as I say and not as I do.
Yeah.
And, when you talk about modeling and how important that is, because children do learn to behave by the behaviors that they see modeled in their parents, and just being patient and realizing it is not about you, it's about the kid. And, sometimes that's hard because you have your own feelings also as a parent, like, well, they like that one better and I'm the person that's doing this. And I've heard it. It comes out, and I felt it at times. It definitely is, it's complex in so many different ways, but there's so many things that we can do as parents to help our children to survive and to thrive through a divorce. Dr. Denny Zulu, I thank you so much for joining the show and for giving us those tips. I want you to remember that a parenting plan can help you to be successful, and some of the things that we talked about building into that parenting plan to help the family be successful, to help the child be successful, and to help the children to be successful on the other side of a divorce. You can be well, they can be well, and there's some things that you have to do in order to get there. But thank you again. You guys have a wonderful rest of your Sunday, and you can be better on the other side of divorce. Thank you for joining today.
I say you clingy and you contradict. Give you my heart, you think it's counterfeit. Give you my word and you won't trust in it. What's the point of loving me if you don't know what trust is? I need the ease you give.